Hi, welcome to the first parent webinar in our mental health support for students during COVID-19 series. This evening, we'll be talking about the impact of COVID on youth mental health, what to look for, and what to do. A little bit about me before we get started. My name is Sarah Underdahl. I'm a licensed independent clinical social worker, and I work as a therapist with the Scott County Mental Health Center Connect program in the Prior Lake, Savage, and Jordan school districts. My contact information is on this slide, as well as at the end of our presentation this evening. So you can feel free to reach out to me with any questions there. A little bit more about the Connect program. The Connect program is a partnership between the Scott County Mental Health Center and Scott County schools. It allows therapists to be co-located in schools across Scott County. Typically, those services would take place during the school day, but currently they're taking place virtually. Services provided in the Connect program include individual, family, and group therapy, staff consultation and trainings, family consultation, crisis intervention and assessment. It really just depends on kind of the needs of the school. If you are interested in these services for your child, you can talk with your school social worker or school counselor and ask about that referral process, and they can talk with you more about the services that are available at your school. The other districts that the Connect program is in is Shakopee, Belle Plaine, Jordan, New Prague, and the Southwest Metro Intermediate School District. This evening, we'll be discussing the COVID impacts on mental health, steps to supporting mental well-being and strategies you can utilize over winter break, warning signs of mental health concerns, tips for talking to your child, and simple steps to getting more support. We know that with the onset and continuation of the COVID-19 pandemic, that many things have changed about our world. The stressors, changes, and precautions due to COVID-19 have had an impact on mental health and well-being across the lifespan. Families are experiencing increased stress due to medical, financial, health, childcare concerns, being home more frequently and not as able to engage in sources of informal and formal support like going to work, school, spending time with friends and family outside of the home can lead to feelings of isolation. We know that disruptions to routines like going to school, leaving the home to go to work, job loss, changes in holiday traditions, and the ways that we're able to interact with the world can lead to feelings of grief, sadness, anger, and a decreased feeling of safety in the world. Difficulty with not knowing what comes next and it being difficulty to plan for even the near future can create a lot of uncertainty, which is really challenging for a lot of individuals. All of these additional stressors, changes, and difficulties can lead to decreased mental well-being and new mental health symptoms. Things like changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, worsening of current mental health conditions or experiencing new mental health symptoms, and increased use of tobacco, alcohol, or other substances. All of these things can impact mental health and symptoms of mental illness. So knowing all of that information, what can we do to help improve our mood and increase our coping during this time? This is by no means a list of the only things that you can do, and you do not need to do everything on this list. As I kind of talk through these different points, you can really think about what will fit best within your family culture and what feels most supportive to you, and then leave the rest. So first is creating a routine that works for you and your family. With there being a high amount of change to current routines, thinking about how can we create that consistency for ourselves and for our children to decrease some of that stress around the unknown. It might look like an hour-to-hour schedule, Or it might look like more of just this is kind of the general flow of our day. We typically wake up at this consistent time during the week. We get ready, we eat breakfast, and then we complete school and work. We eat dinner around a certain time every evening, and bedtime is at the same time every weeknight. It could also look like an hour-to-hour schedule. Again, just really what kind of works with your family and the routine that you currently have. Also continuing to get active in ways that feel good for you, whether that's, winter sports, gym workouts in your living room, walking the dog, yoga, moving your body in any way can help to reduce stress. So getting a good night's rest is always important. That sleep routine can really help our mood and decrease stress. We know that, creating this bedtime routine and typical time that we go to bed and getting good sleep at night can help to reduce stress and increase our ability to cope with difficulties during the day. Connect with what brings you meaning. So whether that's meditating, attending religious services, reading books, expressing gratitude, spending time in nature, again, whatever brings you meaning and connecting with that. Being mindful about the types of foods that you're eating, ensuring that you're getting balanced nutrition to fuel your body. Limiting social media if that is what it feels like you need right now. Sometimes the amount of news and information that we're constantly overloaded with can feel really overwhelming. And so if you notice that for yourself, it's becoming too much or too overwhelming right now, it's okay to set boundaries for yourself and set limits on how you're engaging with the news and with social media. So that might look like I'm only going to check this one news source once a day or every few days. I'm only going to look at the CDC website for updates on COVID. I'm going to take a break from other social media websites. Again, kind of whatever that looks like for you. But just know that it's okay to set those boundaries around social media and how you engage with it. Prioritize connection with others in whatever way feels comfortable for you. This might look like getting together outside or connecting virtually or through phone calls. You can really be creative with this, but just really ensuring that you're still getting that connection time with others. Allowing yourself time to rest and recharge. It might be in the morning before anyone wakes up, you're deciding that kind of your time for yourself is that you're going to just sit and drink coffee quietly. Or it could be, a certain evening of the week, your family kind of has a plan that, okay, this is when this individual is going to kind of engage in this like break time for themselves. So really just making sure that you're still prioritizing rest and time to recharge and engage in some of these practices. A few additional thoughts about self-care and coping. Like I said earlier, there's really no one right way to cope. It's whatever is going to work best within your family and whatever feels good to you. There is this misconception that self-care is this process of stopping when we're feeling really overwhelmed and when we need a break. And so it's this process of, I'm going to stop, I'm going to get myself together so that I can be present and do my daily tasks again. But what we actually want it to be is this, this thing that you engage in regularly, and it's really part of your routine. And so it allows you to remain present rather than something that we're engaging in when we only really feel like we need it. So we want it to be something that's really proactive rather than reactive. So this is 50 ways to take a break. It's just a lot more ideas of things that you can do to help refuel yourself during this time. There's many listed, but I'll just read off a few. Writing a letter, sitting in nature, reading or watching something funny, turning off all electronics, listening to a guided meditation, calling a friend, spending time in nature. So again, really what works for you. And I'll stay on this slide so a little while just so that you can kind of take a peek at the other ideas that are there as well. Thinking specifically about winter break with your children and families, winter break is often a time when families are traveling or getting together with extended family or taking part in other traditions, and those things might look different this year. So, really, first, just normalizing and checking in. The biggest thing that we can do is normalize that it's difficult, that it's different this year, that things might look different for your families, your traditions and routines might be changing. And so you might say something like, it's really hard not to get to spend time with your grandma and grandpa this year. I wonder how you're doing with that. So you're normalizing it, you're kind of sharing a little bit of your feelings and also checking in with your child. And then just validating any feelings that are coming up for kids. After we've done that, also reminding ourselves and our kids that this is something that's not going to last forever, even though it's really hard right now. It feels like, it's gone on for a long time and that, maybe it feels like there isn't going to be an end, but reminding ourselves and our children that, this is temporary, even though it doesn't feel like it. And it feels really hard right now, but we will be able to return to these activities and these routines. Plan ways to connect and carry on traditions or create new ones. So this could look like connecting virtually. You might plan to watch a show at the same time as family members that are out of the home. You might enjoy the same food. You might mail letters or packages or drop those things off. You might have a special object in each family's home in order to feel connected. Also, if there's new traditions that you're wanting to try, maybe you're planning that together with your family or with your children. So talking with them about, what do you think we should do this year? Is there anything that you've really been wanting to try around this time or anything you're really hoping to do during your break this year? Including your child's thoughts and opinions and planning whatever you do can help them to feel like they have more control and know what's coming. And again, just decreases that uncertainty. So diving right into different mental health symptoms that you might see that are kind of warning signs or indicate that there might be an underlying concern. You might notice your child is excessively worrying or has a lot of fears. Stress and worry is normal. It's something that motivates us to do things like study and do well on tests or practice for sports, but sometimes worry feels really overwhelming and it's really intruding on our activities. And so if you're noticing maybe your child is verbalizing these worries or they frequently seem really preoccupied, maybe their worries seem bigger than the situation warrants, or they just have a lot of fear and so they're avoiding situations, that can be a concern. If you notice your child is reporting that they're feeling really sad or low or depressed, this could look like them actually reporting that they're feeling sad, or they might just appear sad or tearful. Confused thinking or problems with concentrating and learning. A lot of times we associate this with ADHD, but it's also associated with other mental health disorders. If someone is really preoccupied with their worries or feeling really depressed, it can be really hard to concentrate and learn other things. Extreme mood changes, like uncontrollable highs or feelings of euphoria. Maybe you notice that your child one day seems to have a lot of energy. They appear, just in a really, really good mood, very elevated, almost euphoric. And then the following day or a couple days, maybe you're noticing that now they appear depressed. That kind of cycling is concerning. Prolonged or strong feelings of irritability or anger. Maybe you're noticing that your child's engaging in more like talking back or verbal aggression, or it's kind of intruding on your relationship and your child is so irritable that it's causing like conflict more frequently. If your child is avoiding friends and social activities, we know that right now that looks a little bit different, but if they're really not wanting to engage and they don't seem to have kind of that desire to engage with friends, that can be a concern. Difficulties understanding or relating to other people. If you notice that your child has a really hard time understanding social cues or relationships. Changes in sleeping habits or feeling tired, having low energy. It could look like your child is having a really hard time falling asleep at night, or they're waking up really frequently throughout the night, or they're sleeping too much. So really kind of a spectrum. It could also look like it seems like they're getting enough sleep at night, but they still just appear to be really fatigued and tired throughout the day. Changes in eating habits, again, that can kind of be either end of the spectrum, whether that's they're eating a lot or they really have a lack of appetite. If you notice that your child often engages in negative self-talk, they have a really hard time identifying their strengths, they appear to have really low self-worth. You might see a concern could be that they have a difficulty with perceiving reality, and so they're maybe seeing things that aren't there or hearing things that aren't there. Could be that they appear to have more physical ailments without an obvious cause. And so it might look like they're often complaining of headaches or stomach aches, and there doesn't seem to be kind of a physical cause to that. That can sometimes indicate anxiety. If they talk about thinking about suicide, they're making comments like things would be better if I wasn't here. They have a hard time responding to stress. So if you're noticing that your child is having a really hard time, they're becoming overwhelmed really easily. If they talk about or appear to be really concerned with weight gain or are really concerned about their appearance. If you're noticing big changes in school performance, maybe your child previously was really engaged with school and suddenly is quite withdrawn or not engaging as often, or is just having increased difficulties with school. Avoidance of activities or events that they previously enjoyed. It's normal for teens to kind of change their interests over time, but if you are noticing that it seems like they're really isolated or withdrawn. So when is it time to ask for additional help and support? If you're noticing that your child appears to be experiencing or they're reporting experiencing really extreme depression, fear, anxiety, or anger towards themselves or other people, if it seems like their feelings are really out of control and they're having a really hard time managing them, support can be helpful to help them learn skills to manage those big feelings. If they're hearing voices that other people don't, if they're seeing things that other people don't, if other people are mentioning that their behavior is concerning, so whether that's you're noticing the behavior and you're concerned about it, or maybe their friends or teachers are bringing up that they are concerned about their mental well-being. If they are reporting that they're experiencing suicidal thoughts or self-harm, if symptoms have persisted for a long period of time, it's normal for individuals to sometimes have like a tough day or even a tough week, but if that's really persisting over time, like weeks to months or longer, if it's interfering with their daily life, so school, family relationships, friendships, sleep, eating, if you're noticing that the symptoms are really interfering with those things, it's a good time to seek support. So tips for talking with your child. First off, just being really mindful about the time that you're choosing to speak with them. thinking about the time of day that they are going to be most receptive to having this conversation. So for a lot of kids, it's not going to be right away in the morning when they wake up, because at that point they are probably a little bit irritable. They just woke up. They're not ready to kind of engage in these conversations. So thinking about when is your child going to be most receptive and open to that taking place. Be prepared. Again, choosing the right time for your child, but also the right time for yourself and when you're going to be able to engage in that conversation. And then just being prepared that it could go either way. It's possible that they are going to be really open and happy that you talked with them and ready to share. But it's also possible that they are maybe experiencing some shame around these feelings or just having a really hard time talking about it. And so they could respond poorly, like by yelling or just kind of withdrawing and refusing to respond. So just kind of being prepared that, it can go either way. Share your observations and concerns, letting them know these are the specific things I've noticed. That might sound like, it seems like you have been feeling really sad lately. I wonder what's going on. Or it seems like you're not wanting to spend as much time with your friends. Is everything okay? Or I'm worried about you. And we'll have some more examples of what these conversations might sound like, what you could say on the next slide. Starting with joining them in the difficult feelings, if they are sharing them right away when a child is experiencing something hard, a lot of times we jump to wanting to fix it. And so really first just focusing on joining them in those feelings, validating, helping them to feel like they're not alone. You might say something like, tell me more, or what is that like for you? Or even just, wow, that sounds really hard. Connect with the feeling under the feeling. I think that this could be a whole training in itself, but if you're seeing those larger behaviors from your children, like acting out or, maybe they are kind of engaging in some like verbal aggression or destruction of property, what is the feeling that's underneath that? Trying to kind of connect with that feeling rather than the big behavior. Thinking about, is this happening when they're feeling really worried, or are they feeling embarrassed, or are they feeling, are you noticing that it's happening maybe when you're engaging in schoolwork that's really difficult? And so the feeling underneath that is that they're feeling ashamed that they don't understand it. So really just kind of trying to connect with what is underneath those big behaviors. You can self-disclose if you're comfortable with that. So that might sound like, when I was your age, I had a lot of worries and I worried a lot, and that was really hard for me. I wonder if you ever have worries. Or it might sound like if you're talking specifically about right now, it's really hard that we're not able to see our family friends right now. I wonder what that's been like for you. Avoid blaming and shaming language. Don't overwhelm them with too many words. When a child is dysregulated or having a hard time, it can be really hard to take in extra language. And so it's okay just to give them some wait time after you've made a statement or a question. Sometimes, and it's really difficult because it feels like a long time, but sometimes I like to count to 10 in my head before giving any other prompt. So making a statement, counting to 10 in your head, allowing your child that time to process, think about how they want to respond, and then maybe giving another statement or prompt if they haven't said anything yet. And then last, just leaving the door open to future conversations. So you could say something like, oh, I see you're not ready to talk about this right now. That's okay. I'll always be here for you and I want to help. Or you can offer them alternate ways to connect. A way that I really like with young children is using a notebook to pass back and forth. And this doesn't necessarily need to be when you're concerned. It can just be a way to connect, especially if you have kind of an opposite schedule from them. You can use a notebook to pass back and forth to make little like letters or drawings. And it might look like before you go to work, you color them a picture or make them a little drawing in the notebook. You leave it out for them. And then during the day, they can respond. And it's not something that you need to do every day, but it can be a good tool just to let them know that you're still thinking about them even when you're not there with them. For teenagers, you could offer alternate ways to connect, like texting, letting them know, I see that it's maybe really uncomfortable to talk about this in person. If you want, you could text me and we could talk about it, or we could set up a time to talk that way. So some different ways that this might sound. You might say something like, you seem down lately. How are you feeling? Would you like to talk about it? I'm here for you. It's hard that we can't celebrate the same way that we used to or usually do. How are you doing with all these changes? It's normal to feel stressed, but if it feels like that all the time, then we should talk about it. I care about you. You are important to me. Let's make an appointment to talk with someone about how you're feeling. So simple steps for more support. Your school social workers and school counselors are really great about knowing different resources that are available within the school. I know many of them have different kind of groups or kids that they meet with individually. And so you can talk with them about kind of the resources that are available within school. You can also talk with them, as I said earlier, about the Connect program. If you're interested in your child seeing a therapist for school-based therapy, you can talk with them about what that referral process will look like. The Scott County Mental Health Center also has crisis appointments that are available during business hours. So if you have a more immediate concern, you can give them a call at the number on this slide. And so they can provide, some assessment and kind of recommendations for next steps regarding those concerns. And then outside of business hours, on weekends, on holidays, the Scott County Mobile Crisis number is on the slide as well. They can also provide some of that assessment and recommendations for, again, those more immediate concerns. And then for life-threatening concerns, call 911 or bring your child to the emergency room. Other support that's available for you, change2chill.org has some really great resources around different kinds of relaxation strategies and mindfulness activities. NAMI Minnesota is the National Alliance on Mental Illness. The Minnesota chapter, specifically NAMI, has a lot of different groups for caregivers and information on their website and different resources there. The Trevor Project is an organization that works and focuses specifically on the LGBTQ population. They also have a suicide lifeline. The ScreenagersMovie.com resource has different resources for raising a child in this really technology heavy time, and some different resources there. On Wednesdays at 12 p.m. beginning in January on the 13th, the Laker Strong series will start for middle school students. So at either of the middle schools in Prior Lake, this is available for students. And so it'll be a group that offers students the opportunity to learn positive mental health strategies, things like coping with anxiety and positive self-esteem, healthy relationships, and stress management. So if you're feeling like your kiddo could use just kind of the extra boost with some of those skills, that group will run for 6 weeks. And so you can ask your child's school social worker or guidance counselor for a permission slip to sign up for that. And again, that's for middle school students. And then again, here is my contact information. Thank you so much for attending this webinar this evening. I really appreciate your attention, and definitely reach out to me with any questions that you have. Thank you.